Thank you, John, and distinguished members of the UN Group of Friends to Eliminate Hepatitis, Excellencies, esteemed colleagues and partners, ladies and gentlemen. I'd like to acknowledge our UN Group of Friends to Eliminate Hepatitis for bringing us all here together this morning in our efforts to eliminate hepatitis. I also want to acknowledge the Undersecretary for the Philippines, Dr. Maria Rosario, which will deliver Philippines perspective later today. I also want to acknowledge my WHO colleagues from different regions for sharing their perspectives on this elimination of hepatitis. I also want to acknowledge all the member states for all the good work and the hard work that you are doing. We are all into this fight against the hepatitis elimination. A very good morning, warm good morning from Manila. And it's an honor and a privilege for me to be part of this important event this morning. And for all of us to be here today, represent our collective commitment to eliminating hepatitis as a public health threat through strengthened health diplomacy and international cooperation. Our Western Pacific region faces a disproportionate burden of viral hepatitis. With the high number of cases in large countries like China, the Philippines, and Vietnam, and alarming high prevalence rates in several Pacific Island countries, and this scale of challenges is significant. Over 100 million people in the Western Pacific are living with hepatitis B or C, accounting for 1/3 of the global burden. This contributes substantially to liver disease and cancer death, accounting more than 40% of global hepatitis mortality. And this statistic requires an urgent, coordinated response. To address this challenge, WHO in the Western Pacific has taken strategic, evidence-based steps to accelerate hepatitis elimination. We established the Regional Validation Advisory Group for the elimination of mother-to-child transmission of HIV, hepatitis B, and syphilis, and hepatitis elimination as a public health problem. This advisory group plays a pivotal role in guiding our member states toward achieving elimination targets and fostering collaboration among countries. A two-pronged approach is key to ending hepatitis: prevention through vaccination, particularly for newborns and infants, and testing and treatment, especially for adults. Our region has made significant progress, with most member states achieving over 90% coverage for the 3-dose hepatitis B vaccination, serving a cornerstone in preventing new infection for future generations. But however, treatment coverage remains low. Only 6% for hepatitis B and 16% for hepatitis C, leaving many at risk of developing liver disease and liver cancer. While we have expanded testing and treatment services, more efforts are needed at the primary health care to reach the unreached population. This requires not just scaling up services, but also implementing robust, evidence-based strategies, including disease burden modeling, investment cases, and governance framework. Such approaches have enabled countries to prioritize hepatitis elimination and secure political commitment. Several countries in the region are advancing toward elimination validation or path to elimination. Malaysia has achieved validation for the elimination of mother-to-child transmission of HIV and syphilis and aiming for hepatitis B. China is advancing subnational validation for the triple elimination of mother-to-child transmission. Mongolia has made strides in hepatitis elimination by expanding health insurance to cover HCV and HPV testing and treatment under the Healthy Liver Program. Niue is on the verge of becoming the first country in the world to be validated for hepatitis B elimination. These achievements underscore what can be accomplished when countries commit to evidence-based policies, integrated systems, and collaborative partnership. Today, as we focus on the theme of health diplomacy and international cooperation for the global fight against hepatitis, we must leverage this platform to advocate for continued investment, policy commitment, and collaboration. WHO in the Western Pacific remains steadfast in our support to member states in this journey, offering technical expertise, facilitating partnership, and ensuring that no country is left behind in the fight against hepatitis. Thank you for your dedication, partnership, and unwavering commitment to this cause. And I want to end with one of Helen Keller quotes: "Alone, we can do so little, but together, we can do so much." Mother Teresa said, "What I can do, you cannot do. What you can do, I cannot do. But together, we can achieve a lot." John and the UN group of friends to eliminate hepatitis, thank you for bringing us all here together in our effort to eliminate hepatitis. Thank you.